Hey, Deborah, you got a minute?
Hey, yeah, come on in.
Oh, okay.
How you doing, Lloyd?
I'm doing all right. I want to talk to you about one of my seniors out there, Mr. Smallwood.
Yeah, what's going on?
He seems a little depressed. His wife passed away about 6 months ago, and he just seemed like he going down. You know, I speak with him, trying to find out what's going on, but he hardly speak to me like he used to talk to me.
Okay. Well, I appreciate you bringing this, to my attention. And 6 months seems like a pretty long time,
Yeah,
but
yeah.
for the senior and the grieving process, which is natural,
Right.
it takes some people a little bit longer than others to kind of work their way through it.
Right. Well, I'll just continue to work with him, talk with him, try to get him out, put a little sunshine in the house,
I think that sounds like a great plan. You do a really great job with your seniors anyways. If you want to spend a few little extra minutes and make sure he's okay and just keep me abreast, I think that sounds like a great plan.
We'll do so.
Thank you for talking to me about
continue
it.
to work with you.
Hello, my name is Dr. Barbara Riley. Thank you for viewing this video. Our objective is to assist you in understanding some of the more important issues facing you and your clients as you make your rounds. Our topic is depression in seniors. Is depression in seniors normal? No, it is not. A depressed senior is sick. A depressed senior has no energy, hope, or drive, may have thoughts of death or suicide, and many things can cause a senior to be depressed. Depression and grief in seniors are not the same. It is not always easy to tell one from another. Grieving involves good and bad days. Sometimes you can play and laugh with the grandchildren, but some days you can't. Grieving does not last as long as depression. If it does, the person needs professional help. A grieving person may have happy and joyful moments. A depressed person may have severe guilt, have thoughts of suicide and dying, feel hopeless and worthless, have slowed speech and body movements, and may not be able to function. There are also many other things that are seen in a person who is depressed. Is there a single cause for depression in seniors? No. Sometimes, but most of the times, no. There are often many causes. Mental health causes are when a person feels hopeless, helpless, or has a mental illness. There are environmental causes. A person may have to move from one place to another, such as going into a nursing home. A person may have lost a loved one or all of his or her social contacts. A person may not be able to get around as well as before and lose his or her independence. There are many causes for depression. There are genetic causes, usually a family history of depression. There's heart disease. There's stroke. There are head injuries. There are diabetes. And many other illnesses cause depression. Substance abuse causes depression. Alcohol or drug misuse. Medications may cause depression. And the list of medications causing depression is much too long to list. And most of your seniors are probably taking some of those medications. Can depression in seniors be treated? Yes, it can. A person may take medications for depression, have counseling, go to support groups, rely on support systems such as church, friends, families, senior centers, exercise. You've heard the saying, move it or lose it. And a depressed person may find new things to do which will spark an interest. Treatment for depressed seniors is quite often successful. What can you do as a Meals on Wheels volunteer? Watch for changes in behavior. Be a good listener. Ask about feelings. Encourage support from others. And encourage exercise if your senior is mobile. And please, refer to your social services manager if you are alarmed by a client's behavior. There are certain things that you can say to a depressed senior that may be helpful for them, but there are some things that you should not say. For example, you can say something like, "I'm here for you," not something like it's all in your head. You can say something like, "There's hope for you," not say something like, "All you need to do is relax." You can say something like, "You can survive this," not something like, "Well, just get a new job," and many other things that you can say that will help the senior. Our most important take-home message for Meals on Wheels volunteers and staff is to be aware of changes in behavior, especially talk of suicide or wanting to die. And remember, Paul Davis said, "The sun always shines above the clouds." Thank you to Meals on Wheels staff and volunteers everywhere.
Always remember, put the client's best interest first, safety is paramount, and let us know if there are any changes.